Hi, my name is F.Kiarie and I'm doing my presentation on urinary catheterization complications in elderly patients. Research indicates that catheter-associated urinary tract infections are the most common complications. Others include urinary tract trauma, blockage, bladder spasm, and discomfort. Elderly patients are prone to these complications due to decline in physiological functions such as bladder capacity and weakened sphincter muscles. Article by Miles 2009 indicates that 72% of catheterized patients will experience a complication. Elderly patients often have many problems such as diabetes, hypertension, and chronic kidney diseases, which compromise their immune system. They require longer hospital stays due to the complexity of their medical conditions, and they require more assistance with catheter management due to limited mobility and cognitive impairment. Article by Waskiewicz ETAL 2019 indicates that prime reasons for infection include the use of inappropriate cleaning methods to prevent blockages and a lack of care to the bladder neck. Hospitals and long-term care facilities may not have sufficient staffing to adequately monitor and manage urinary catheterization complications in elderly patients. Patients tend to complain of pain and require more assistance to use the bathroom frequently. Article by Singh ETAL 2021 indicates that urinary tract infection is a clinical diagnosis with symptoms of dysuria, urinary frequency, and urinary urgency, as well as suprapubic pain. To conduct a rapid critical appraisal of guidelines related to urinary catheterization, evidence-based practice should involve different patient safety initiatives. Article by Harold ETAL 2013 indicates that safety initiatives to determine what other factors affect how risk is perceived and how these perceptions impact patient care and the implementation of patient safety initiatives. To begin with, we need to ask the appraisal questions such as what is the effectiveness and safety of different strategies for changing enduring urinary catheters? What are the implications of the review findings for clinical practices? By answering the appraisal questions, nursing staff can better understand the strengths and limitations of the evidence presented as well as the potential implications for clinical decision making. To develop the practice change and implementation standardized protocols and guidelines for urinary catheterizations procedures, including indications for catheter use, appropriate catheter selection, insertion techniques, and maintenance practices need to be developed. Providing training and education for nursing home staff in patient-centered care can help to improve their skills and confidence in engaging in this approach. Nursing homes can develop a culture that supports patient-centered care with a focus on individualized care and patient involvement in decision making. Ensure that nursing homes have adequate supply of appropriate catheters, insertion kits, and maintenance supply readily available. Foster effective collaboration among different healthcare professions such as nurses, physicians, infection control practitioners, and quality improvement team to facilitate the exchange of knowledge. identify barriers, and develop strategies to overcome them. Nursing homes can allocate sufficient time for staff to engage in patient-centered care, such as reducing administrative tasks and increasing staffing level. A study was conducted in 7 nursing homes in southern Michigan. Article by Modi et al. 2010. It indicated that nurses and nurses' aides were the developers in this study, and 356 healthcare workers were involved. Theoretically, models such as diffusion of innovations models and the trans-theoretical models can be used to guide the implementation process. These models provide a framework for understanding the stage of change, identifying barriers to change, and tailoring interventions accordingly. If a barrier to implementing the practice change is resistance from staff members, the diffusion of innovation model can help identify early adopters who can serve as champions to influence their peers. Some of the barriers that may be encountered include resistance to change, lack of resources, time constraints, and lack of knowledge or skills. Providing ongoing support, feedback, and mentoring can help overcome resistance to change. Addressing knowledge gaps through education and training can improve staff competency and confidence in performing catheterization procedures. Involving staff members in the decision-making process and soliciting their input can foster ownership and engagement, increasing the likelihood of successful implementation. Internal sources of evidence that can demonstrate improvement in outcomes include data collected from nursing home records, incident reports, and surveillance systems. For example, comparing urinary tract infection rates before and after the practice change can provide evidence of improved outcomes. Additionally, staff feedback and satisfaction surveys can provide valuable insights into the impact of the practice change on their experience and perceptions. Article by Myrank and Fineout, 2015, indicates that with achievement of more exceptional in clinical outcomes, nurses must incorporate skills and knowledge with research-based evidence into decision making. Compliance with catheter insertion and maintenance protocol can be evaluated to ensure that best practices are being followed. Evaluation methods of implementation can involve qualitative and quantitative approaches. Article by Barbie et al. 2010 indicates that the main advantage of quantitative research is that it allows researchers to correct and analyze data in a rigorous and objective manner, which can increase the validity and reliability of the study findings. Another article by Miles, 2009, indicated that within the year before the project started, 46 unscheduled visits were made for catheter management at the participating sites. During the project period, the number of unscheduled visits for catheter management had decreased to 30 at the same sites. The effectiveness of the practice change is monitored and evaluated to determine its impact on patient outcome and identifying areas for improvement. This can involve regular charts review, audits, and reporting mechanisms. In adult patient hospitalized in long-term acute care hospital, how does the use of a nurse-driven protocol for evaluating the appropriateness of short-term urinary catheter continuation or removal? Article by Mark Zurek, et al., 2016. Time frame: the patient keeps the catheter can range from a few hours to several days. need to be evaluated. Ethical consideration in this context include ensuring patient autonomy and informed consent in the decision to catheterize, maintain patient privacy and dignity during the procedure, promoting patient safety by minimizing the risk of complication. Additionally, it is essential to communicate the purpose and the benefit of the practice change to staff and address any concerns they may have. Thank you.